Do you suffer from fibromyalgia? About 5 million Americans are diagnosed with fibromyalgia. 80 to 90% of those are women. Hi, I'm Dr. Ruth, the Pain Doc, founder of Chronic Pain Rescue, telehealth practice dedicated to helping those suffering from chronic pain to live a lot pain-less lives and to have a higher quality of living. Today, I just want to share some information about fibromyalgia. It is rare, but it involves a significant number of people. One of the problems with fibromyalgia is that it is sort of an orphaned diagnosis. There is no scan, there is no blood test to tell you that you have it. Oftentimes it's diagnosed late because primary care physicians are not trained or practiced in making that diagnosis. The American Rheumatology Society previously had a criteria of tender points, and that has been abandoned because many practitioners didn't know how to look for that, and the testing was done improperly in some cases. So basically, it's a diagnosis of symptoms, mainly chronic fatigue, cognitive disorders, and impaired sleep, a restless sleep, in addition to the pain. And it is generalized pain. If it's pain only in one region of the body, most likely it's not fibromyalgia. I think the most important thing for someone with this disease is to get yourself educated about it. A healthcare practitioner can hopefully help you to understand more about the disease, and certainly you can look at videos like this to educate yourself about it. There is no magic pill. There is no magic bullet that is going to take care of fibromyalgia completely. Basically, this is a disease that responds best to a multidisciplinary approach. So you have pharmacologic interventions, meaning medications, as well as non-pharmacologic interventions, which would be exercise, mindfulness, and various other things that can help. One thing, there can be kind of two extremes or two other ends of the pole of people with fibromyalgia. Many times older people with that diagnosis become very, very sedentary, not moving, not going anywhere. That is not the way to go. It's important to stay mobile. It's important to move. It's important. Aerobic exercise is something, even if you can only move, say, for 5 minutes, walking around in your house just to get you started until you can bring that up to 10 minutes, 15 minutes, 20 minutes, even going outside to build up your stamina, your aerobic conditioning. But then there's another extreme, and many times younger people, women that have this diagnosis, are still working full time. You have obligations at home, obligations in your community, with your family, with friends, and you're trying to keep up. And I want to speak to those people to recognize that you may not be able to really keep up if you have fibromyalgia. You should look for ways to conserve your energy. Like, what time of day do you have the most energy to do the things that you need to do, and try to take that time when you have the most energy to do things, not overexert yourself, but to do the things that you can do so that you rest on the times when have less energy and you're down. One intervention that I'd like to share that's shown a lot of promise and hope is aqua therapy. Even just walking in the pool, a warmed pool, people with fibromyalgia noted that they had less stiffness, better cardiovascular health, a deeper sleep, less anxiety, and less depression, as well as less pain. So if you haven't considered that, certainly look into that. As I said, I'm Dr. Ruth, the Pain Doc. This is another posting for Chronic Pain Rescue. Please visit our website. Please like our posts, subscribe. And if you would like me, I would love to be a partner in your health, in helping you to live with a lot less pain, to live the kind of life that you want to live, that you imagine to live, if you didn't have the pain that you're suffering from now. And with that, you can certainly sign up for our email list. We'll be ready to see patients very soon, and I'd be honored to work with you. If you have any questions, any other issues, please feel free to reach out. Until next time, peace and blessings.